Let's talk about a powerful tool in critical care, ultrasound, and how we use it during weaning from mechanical ventilation using the ABCDE approach. A is for airway and lung ultrasound. Why do we use it? To detect causes like pulmonary congestion, consolidation, pleural effusion, or pneumothorax. When do we use it? From the early phase of ventilation and especially during the weaning phase. How? Start with a 6-view scan using the Blue protocol for diagnosis. Use a 12-view scan to monitor lung aeration over time. Just before and after a spontaneous breathing trial, do an 8-view scan. If you see 5 or more B lines, it signals a high risk of extubation failure. B is for below the diaphragm. Why? To detect ascites, blood, or pus in the abdomen, which can affect breathing mechanics. When? During the weaning phase. What to look for? FAST protocol helps detect free fluid. Hypoechoic fluid is likely uncomplicated. Loculated or complex fluid may indicate infection or bleeding. C is for cardiac ultrasound. Why? Cardiac dysfunction is a major reason for failed weaning, like LV failure, RV overload, or diastolic dysfunction. When? Early on, during weaning, or after a failed spontaneous breathing trial. Start with a basic transthoracic echo. If unclear, escalate to advanced echo or T. Watch for E' less than 8 cm per second means there is diastolic impairment. E by a greater than 2, if ejection fraction is reduced. E by E' greater than 12, if EF is normal. D is for diaphragm. Why? Diaphragm dysfunction is common in ventilated patients. When? After failing the first SBT. Use subcostal views to check excursion. Less than 1 to 1.5 cm bilaterally suggests dysfunction. Also measure diaphragm thickening via intercostal view. A thickening fraction below 30 to 35% or thickness loss over 10% from baseline indicates risk of failure. E is for extra-diaphragmatic muscles. Why? These muscles may compensate for weak diaphragms, but their atrophy can lead to extubation failure. When? After a failed SBT or failed extubation. Check peristernal intercostals. If the thickening fraction is under 10%, risk is high. Also, evaluate abdominal wall muscles during a cough. If there's reduced thickening, extubation may not succeed. So, the ABCDE ultrasound approach is a stepwise, system-wise scan to uncover the causes of weaning difficulty. It helps guide clinical decisions, prevent extubation failure, and personalize care for each patient in the ICU.